In our office, we see a lot of neck, upper back area issues here, seated position, a lot of sports, causing a lot of stuff going on into here. I'm Dr. Kevin Christie, and in this video, I'm going to show you how we do active release technique to release any trigger points and tightness in the muscle group. In particular, there's a muscle called the levator scapula right here. It's called levator scapula. It elevates the scapula. The scapula, or the shoulder blade, is going to be here. So a lot of times we're kind of shrugged up a little bit, and this muscle group's going to run from here to about through here. So I bet you a lot of you are relating to some having issues in there. What's great about active release technique is that we're going to actively move. So we're going to go from a shortened position of that muscle group to a lengthen as I get on there with the thumb, and then we're going to really try to release that as the patient actively moves. So I'm going to show you a few different ones that really get into here. Oftentimes as well, you're going to have an issue right through here where we need to do a chiropractic adjustment to help get some motion into the mid-back. So that's going to be a great thing for us to do. But from a muscular standpoint, we're going to work into here. So the first one I'm going to have you do, all right, is we're going to go ahead and tuck that the top button for me there. Good. I'm going to get right into there with my thumb. I'm going to have you look down and to the left for me, okay? Good. And then we're going to really get in there. Good. So we went from a shortened position of that muscle group down to a lengthen. And I'm getting in there. He could attest to that we're finding a good spot on him right there. And we're going to do a handful of passes of that. Good. So that would be kind of the first one we would do. The next one we're going to do is I'm going to take this arm here. You're going to reach past the left knee, go as far down as you can, and then tuck the chin down to the left. So it's a combination move. We're going to get into there, come back up, okay, and go. Good. Two more. Feels good, doesn't it? Mm-hmm. We're really getting with that muscle group well into there. Perfect. Then the third one I do is let's leave the neck alone. I want you to bring that arm and then a little more angle down into like that. And go. Good. One more. Perfect. And that's active release technique for that levator scapula and a couple areas around it, serratus, posterior, superior. There's a few things going on there. If you're sitting at a desk and you're on that mouse all the time, if you're playing certain throwing sports or racket sports where in golf, where you're doing a lot of upper extremity movements, you're going to potentially deal with this pain right into here. The good news is we can actually evaluate this, treat it on the same day, and usually get pretty quick resolution of it. But oftentimes it's just hard for you to get here or anybody else, and we really have a skill of finding the exact issue and then really releasing that for you. So that's active release technique, levator scapula, a couple other areas around that, but really help with your lower neck, upper back pain.